Hi, welcome back to Health Score. Today we're visiting the area of psychological health. In particular, we're looking at the recommendation to treat anxiety. There was a screening question about whether you've felt anxious about multiple areas of your life for the past several months in the initial survey. And in the resource section of this lecture, there's the GAD-7, which is a screening for anxiety, which will give you a specific score, and that score can help you determine the severity of your anxiety. So if you answered the first question in the initial quiz that you are anxious, I recommend you take the GAD-7 so you have your score before you proceed with the rest of this lecture. Anxiety produces an increased risk in premature death, so it's definitely a concern if you have anxiety. Of course, knowing that it's a risk factor for premature death isn't going to make you less anxious, but it hopefully will give you the motivation to take it as a serious issue and not feel like it's an inevitable part of your life, but something to address that's a modifiable risk factor that you have control of. So let's talk about what you can do. First tip is flow. You can think of anxiety as the result of boredom. We have an area of the brain called the default mode network. The default mode network is active when we aren't engaged in something that captivates our attention. The default mode network is what's active when we're thinking about the future or ruminating about the past. And when people are anxious about the future or have regrets about the past, this can lead to anxiety and depression. So one way of preventing the anxiety that results from boredom and an active default mode network is to find engagement in the present. When we are fully engaged in the present, the default mode network is quiet. And that can result in our really not having the cognitive space in our heads to worry about the future because the present demands so much from us. The most evidence-based and popular method for being fully engaged in the present is called flow. Flow is a experience that's been described in top athletes, in people in all walks of life, in ordinary people. In fact, flow can be achieved by anybody, and it's really well described in this book by Mihaly Csikszentmihalyi, and I recommend you read it. What Csikszentmihalyi outlines is a formula for achieving full engagement in the present in a way that leads to flow or optimal experience. He describes 3 basic steps in becoming fully engaged in the present. Step number 1 is a clear and specific goal. Step number 2 is finding a challenge that matches your skills. And step number 3 is getting immediate feedback. If you think of a lot of passive leisure, like watching television, we don't really have a goal. We're not really challenged. We're not getting any feedback. If you think about active leisure, like going for a hike, there where maybe the goal is to get to the summit, or maybe the goal is to keep our heart rate above 100, or maybe the goal is to get 10,000 steps, or maybe the goal is to not have a goal, but just be completely present in our bodies. We feel the challenge of climbing and of navigating the trail and of avoiding poison oak. We feel feedback and our heart rate increases and our breathing increases. We feel warm. We feel vitalized. We feel endorphins from the activity. There are many examples of flow, and the common denominator is that they're active. They require something of us. Unlike the most popular form of leisure, television, which requires nothing of us. Another tip for treating anxiety is therapy. And cognitive behavioral therapy is the most proven way to address generalized anxiety disorder. Essentially, in cognitive behavioral therapy, you examine the thoughts that lead you to the feelings of anxiety. You examine the actions that lead you to the feelings of anxiety, and you question those thoughts and you revise those actions so that you can take practical steps to feeling less anxious. Next recommendation is exercise. Exercise is a proven stress reducer. Not only does it, a lot of times we are stressed out from psychological stresses. So in former times when we were on the savannah as hunter and gatherers, we had acute stressful events like a lion chasing us or another tribe trying to take over our land. So we had acute threats and we dealt with them in physical ways. Our fight or flight response was triggered and we either fought or we fled, but that was a physical response. In the modern world, we have lots of psychological stress, which causes the same fight or flight activation of our adrenal glands and our cortisol, our stress hormones, but doesn't have a similar outlet as our hunter-gatherer ancestors by fleeing or fighting. We don't have a physical outlet for the psychological stress of the workplace. And so we can carry that stress in our muscles because we don't have an outlet for relieving it. Exercise is a socially acceptable. I mean, it's not like fighting or fleeing when you're stressed, but it's a socially acceptable outlet for the fight or flight activation that happens in modern life. The two recommendations for exercise are, and this is for exercise for overall health, not specific to anxiety, but if you're managed to achieve these two types of exercise, then not only are you benefiting your overall health, but you're benefiting your mood and reducing anxiety at the same time. The two categories are aerobic exercise and resistance. Aerobic includes 150 minutes of moderate intensity exercise per week. That would be the equivalent of 30 minutes of brisk walking 5 days a week, or 75 minutes of vigorous intensity exercise. Resistance training is also important, and 2 sessions a week are recommended and have the biggest health benefit. This does not have to be weightlifting. You can use your own body weight in apps like Home Workout, or you can do things like yoga, which use your own body weight and engage your core and improve your flexibility, your range of motion, and your strength. I recommend the Down Dog app for exercise, for strength training. Meditation has been proven to improve anxiety and stress. Instead of reacting to our thoughts, meditation allows us to observe them as thoughts in consciousness and not necessarily as our thoughts or triggers that we have to respond to. I have found benefit from apps. And my favorite app so far is Calm. I've also enjoyed Metatopia, but whatever app I'm using, I'm committed to a habit of 10 minutes per day of some form of a guided meditation through one of these apps. Next is smartphone use. Anxiety, depression, and insomnia all go up when smartphone use goes up. And a smartphone is not an unmitigated evil. It's just a tool that can be beneficial if we are in control rather than the apps and the media and the social sites that are trying to get our attention. So some good habits around smartphone use are limiting your use to not more than 2 hours a day, specifically scheduling your use. Like I have about an hour a day that I spend after work on my smartphone. Opting for in-person interactions over virtual whenever possible. Removing app notifications. This goes back to being in control of your attention and not having things control your attention. Turning off your work mode on your phone when you're not in the office. Putting away your phone when you're eating or basically doing anything else. Unplugging the hour before sleep. And when you go online, having a purpose for going online beforehand and setting a time limit for how long you'll be online. Next is green space. Our exposure to green space is proven to improve mood and reduce stress. Green space could be a park if you live in a city. It could even be trails if you live in a city. The All Trails app is a great way of finding local trails, and they're reviewed, and so you can see what's most popular in your area. In San Francisco, my favorite trail is the Mount Sutro Loop, and I hike that probably at least 5 times a week. It's great. Next is COVID. Now, this is special for the times, but people in my practice, my patients, I've screened for anxiety before and during COVID. And before COVID, about 10% of patients were screening positive for anxiety. Now it's at least 90%. And people automatically assume that anyone would be stressed from COVID. And my counter to that is that COVID is a virus and it causes respiratory symptoms. It does not cause stress. It is the media that we attend to that causes stress. When we follow up-to-date case counts and the most horrific story the media can produce for today on COVID, we stress ourselves out. So the virus doesn't stress us out. It's our attention to the virus that stresses us out. So my overall recommendation for media is to limit your attention to what's in your sphere of influence and what you can make a difference about. And the guidelines for COVID haven't changed. Self-isolate, wear a mask, maintain 6 feet of distance. Knowing the case count today and tomorrow is not going to make a difference, but it could lead to a lot of suffering because of stress. And finally, medication. So the medications used to treat anxiety are the same class of drugs used to treat depression, the selective serotonin reuptake inhibitors. If you scored a 10 or above on the GAD-7, it's a good idea to talk to your primary care provider about, or psychiatrist about potentially trying one of these medications. They're not addictive. They don't produce an artificial high. What they do is they allow serotonin, the feel-good chemical of the brain, to make it from the presynaptic terminal in the brain to the postsynaptic terminal in the brain. So this allows us to experience the normal positive feelings from life that we otherwise would. The problem in depression and anxiety can be we have an overactive enzyme breaking down the serotonin that doesn't give the serotonin enough time to cross the synapse. So the benefit of this medication is not introducing a false artificial high, but in allowing our own feel-good neurotransmitter to have its effect and to work as it's meant to. In this lecture, we covered anxiety. We discussed the health effects of anxiety, how to assess the severity of your anxiety. I shared with you tips for treating anxiety, including finding flow, seeking therapy, doing regular exercise, meditation, digital detox, getting green space, unplugging from news about COVID, and finally, selective serotonin reuptake inhibitors. I hope this lecture helped. I hope that you're able to make progress in relieving your symptoms of anxiety. Thank you very much.